Flagyl is a commonly prescribed antibiotic that has been used to treat a variety of bacterial infections for decades. However, like any medication, it comes with its own set of potential side effects. In this video, we will explore the side effects of Flagyl and discuss the importance of balancing the benefits and risks associated with this medication. While Flagyl is effective in treating infections such as bacterial vaginosis, certain types of diarrhea, and various infections caused by parasites, it can also cause some unwanted effects. These can range from minor inconveniences like nausea and vomiting to more serious complications such as allergic reactions and nerve damage. It's important to understand the potential side effects of Flagyl and weigh them against the benefits of the medication. By working closely with your healthcare provider, you can determine if the benefits outweigh the risks in your specific situation. In this video, we will delve into the side effects of Flagyl, providing you with the necessary information to make an informed decision about your healthcare. We will also offer some tips on how to manage or minimize potential side effects, should you decide to take this medication. Whether you have been prescribed Flagyl or are simply interested in learning more about this commonly used antibiotic, this video will help you gain a comprehensive view of the medication's benefits and risks. Common side effects of Flagyl. Flagyl, also known as metronidazole, is associated with a range of common side effects. These side effects are generally mild and tend to resolve on their own as your body adjusts to the medication. However, it's still important to be aware of them and know what to expect. One of the most commonly reported side effects of Flagyl is gastrointestinal distress. This can include symptoms such as nausea, vomiting, diarrhea, and stomach cramps. These symptoms are typically mild and temporary, but they can be bothersome for some individuals. It's recommended to take Flagyl with food to help alleviate these gastrointestinal side effects. Another common side effect of Flagyl is a metallic taste in the mouth. This can be an unpleasant sensation that affects the enjoyment of food and can linger even after the medication is discontinued. Drinking plenty of water and using sugar-free gum or mints can help mask the taste. In some cases, Flagyl may cause a temporary decrease in appetite. This can result in weight loss or difficulty maintaining a healthy diet. It's important to monitor your food intake and consult your healthcare provider if you experience persistent loss of appetite or significant weight loss while taking Flagyl. While these common side effects are generally mild and temporary, it's important to monitor your symptoms and report any concerns to your healthcare provider. They can provide guidance on managing these side effects or determine if an alternative medication may be more suitable for your condition. Serious side effects of Flagyl. While most people tolerate Flagyl well and experience only mild side effects, there are some rare but serious side effects that can occur. It's important to be aware of these potential complications and seek medical attention if you experience any of them. One of the serious side effects of Flagyl is an allergic reaction. Symptoms of an allergic reaction can include hives, rash, itching, swelling of the face, lips, or tongue, difficulty breathing, and tightness in the chest. If you experience any of these symptoms, it's important to seek immediate medical attention as this can be a life-threatening condition. Flagyl has also been associated with nerve damage, although this is rare. Symptoms of nerve damage can include numbness or tingling in the hands or feet, difficulty coordinating movements, and muscle weakness. If you experience any of these symptoms, it's important to notify your healthcare provider as they may need to adjust your medication or explore alternative treatment options. In rare cases, Flagyl can cause a severe form of diarrhea known as pseudomembranous colitis. This condition is caused by an overgrowth of a bacteria called Clostridium difficile in the intestines. Symptoms of pseudomembranous colitis can include severe diarrhea, abdominal pain, fever, and blood or mucus in the stool. If you experience these symptoms, it's important to seek medical attention as this condition can be life-threatening if left untreated. These serious side effects of Flagyl are rare, but it's essential to be aware of them and seek medical attention if you experience any concerning symptoms. Your healthcare provider can evaluate your condition and determine the best course of action to address these side effects. Factors that may increase the risk of side effects. Certain factors can increase the risk of experiencing side effects while taking Flagyl. It's important to discuss these factors with your healthcare provider to determine if any precautions need to be taken or if an alternative medication may be more suitable for your situation. One factor that can increase the risk of Flagyl side effects is a history of allergic reactions to other medications. If you have a known allergy to antibiotics or other medications, it's important to inform your healthcare provider before starting Flagyl. They can assess your risk and determine if additional precautions or alternative treatments are necessary. Another factor that can increase the risk of side effects is the presence of certain medical conditions. For example, individuals with liver disease may be more susceptible to the side effects of Flagyl, as the medication is metabolized by the liver. It's important to disclose your medical history to your healthcare provider to ensure that Flagyl is safe for you to take. Additionally, certain medications and substances can interact with Flagyl and increase the risk of side effects. It's important to inform your healthcare provider about all medications, supplements, and herbal remedies you are taking to avoid potential interactions. They can provide guidance on any necessary adjustments to your medication regimen. By discussing these factors with your healthcare provider, you can ensure that the benefits of Flagyl outweigh the risks in your specific situation. They can provide personalized advice and monitor your progress while taking the medication to minimize the risk of side effects. Balancing the benefits and risks of Flagyl. When considering any medication, it's important to weigh the benefits against the potential risks. Flagyl is an effective antibiotic that can successfully treat a range of bacterial infections. However, it's essential to understand the potential side effects and determine if the benefits outweigh the risks in your specific case. In some situations, the benefits of Flagyl may be clear. For example, if you have a severe bacterial infection that would not respond to other antibiotics, the potential benefits of Flagyl may outweigh the risks. Your healthcare provider can assess your condition and make an informed decision about the best treatment option for you. However, in other cases, the decision may not be as straightforward. If you have a mild bacterial infection that could potentially resolve on its own or with alternative treatment options, the risks associated with Flagyl may outweigh the potential benefits. Your healthcare provider can discuss the pros and cons of different treatment options and help you make an informed decision. It's important to have open and honest communication with your healthcare provider when considering Flagyl or any other medication. They can provide you with the necessary information to make an informed decision and address any concerns or questions you may have. Tips for minimizing side effects while taking Flagyl. If you and your healthcare provider decide that the benefits of Flagyl outweigh the risks and you choose to take the medication, there are some tips you can follow to minimize potential side effects. Taking Flagyl with food can help alleviate gastrointestinal side effects. By having a meal or snack before taking the medication, you can reduce the likelihood of nausea, vomiting, and stomach cramps. It's best to follow the specific instructions provided by your healthcare provider regarding the timing and dosage of Flagyl. Drinking plenty of water can help combat the metallic taste in the mouth associated with Flagyl. Staying hydrated can also support overall health and well-being while taking the medication. Additionally, sugar-free gum or mints can help mask the taste and improve your overall experience. Monitoring your food intake and maintaining a healthy diet is important, especially if Flagyl decreases your appetite. It may be helpful to eat small, frequent meals or snacks throughout the day to ensure you are getting adequate nutrition. If you experience persistent loss of appetite or significant weight loss, it's important to consult your healthcare provider. By following these tips and maintaining open communication with your healthcare provider, you can minimize the potential side effects of Flagyl and optimize your overall treatment experience. When to seek medical help for side effects. While most side effects of Flagyl are mild and temporary, there are instances where medical attention may be necessary. It's important to be aware of the signs and symptoms that warrant immediate medical attention. If you experience an allergic reaction to Flagyl, characterized by symptoms such as hives, rash, itching, swelling of the face, lips, or tongue, difficulty breathing, or tightness in the chest, it's crucial to seek immediate medical attention. Allergic reactions can be life-threatening and require prompt treatment. Similarly, if you experience symptoms of nerve damage such as numbness or tingling in the hands or feet, difficulty coordinating movements, or muscle weakness, it's important to notify your healthcare provider. They may need to adjust your medication or explore alternative treatment options to prevent further nerve damage. If you develop severe diarrhea, abdominal pain, fever, or notice blood or mucus in your stool, it's important to seek medical attention. These symptoms can be signs of pseudomembranous colitis, a severe complication that requires immediate treatment. It's always better to be cautious and seek medical help if you are unsure about any symptoms or concerns while taking Flagyl. Your healthcare provider can evaluate your condition and provide appropriate guidance and treatment. Alternatives to Flagyl for treating bacterial infections. In some cases, there may be alternative treatment options available for bacterial infections that can potentially minimize the risk of side effects. It's important to discuss these alternatives with your healthcare provider to determine the best course of action for your specific situation. One alternative to Flagyl for treating bacterial vaginosis is the use of topical antibiotics. These medications are applied directly to the vaginal area and can help eliminate the overgrowth of bacteria without the potential systemic side effects associated with oral antibiotics. For certain types of diarrhea, probiotics may be a potential alternative to Flagyl. Probiotics are beneficial bacteria that can help restore the natural balance of bacteria in the gut, reducing the duration and severity of diarrhea. In some cases, your healthcare provider may recommend a different antibiotic altogether. There are many different types of antibiotics available, and your healthcare provider can determine which one is most appropriate for your specific condition. It's important to remember that every individual and every infection is unique. What works for one person may not work for another. By working closely with your healthcare provider, you can explore alternative treatment options and find the best solution for your specific situation. Conclusion and final thoughts. Flagyl is a commonly prescribed antibiotic that is effective in treating a variety of bacterial infections. However, it's essential to be aware of the potential side effects and weigh them against the benefits of the medication. By working closely with your healthcare provider, you can determine if the benefits of Flagyl outweigh the risks in your specific situation. Common side effects of Flagyl include gastrointestinal distress and a metallic taste in the mouth, while serious side effects are rare but can include allergic reactions, nerve damage, and pseudomembranous colitis. Factors such as allergies, medical history, and medication interactions can increase the risk of side effects. It's important to have open and honest communication with your healthcare provider to make an informed decision. If you choose to take Flagyl, there are tips you can follow to minimize potential side effects, such as taking the medication with food, drinking plenty of water, and monitoring your food intake. It's important to seek medical attention if you experience an allergic reaction, nerve damage symptoms, or severe diarrhea. In some cases, there may be alternative treatment options available for bacterial infections. It's important to discuss these alternatives with your healthcare provider to determine the best course of action. Remember, this video is for informational purposes only, and you should consult your healthcare provider for personalized advice. By understanding the benefits and risks of Flagyl and working closely with your healthcare provider, you can make informed decisions about your healthcare and ensure the best possible outcome for your specific situation.